The Centers for Medicare and Medicaid Services have issued a series of sweeping 1135 blanket waivers. Now, the popularity of 1135 waivers is something we've been talking about on this channel, but they've been the waivers coming from states. As of March 31st, over 40 states had requested and received approval on their 1135 waivers that allow flexibility in their state Medicaid program because this is a public health and a national emergency. But there are other types of 1135 waivers that can be requested from physicians, from provider groups, and some that can come right from the Secretary of the U.S. Department of Health and Human Services. The ones that come from the Secretary himself are called blanket waivers. They're largely unprecedented, but they are intended to work in very difficult, trying times like what we have right now. They issue a vast array of temporary regulatory waivers and new rules. And the statement that comes out of CMS is that these equip the American healthcare system with the maximum flexibility to respond to the coronavirus. Now, the Department of Health and Human Services and CMS can use Section 1135 temporary waivers to modify Medicare, Medicaid, the Children's Health Insurance Program, and even parts of HIPAA. One type of waiver, the blanket waivers that we're talking about today, are the ones that impact providers. When this blanket waiver is issued, providers don't have to apply for the 1135 waivers themselves because it's an emergency, like we said. This sweeping order, also called the blanket waiver, will apply instantly to the providers uniformly across the United States. And it's in a number of categories of changes, and we'll go through those quite quickly. The first is what's being called hospitals without walls. It's to increase hospital capacity. It's a change to who can provide and bill for hospital services at a time when hospitals might be filling up with coronavirus patients. Hospital patients that might be needing other services might need to be transported to another facility. Well, that other facility, no matter what it looks like, can bill as a hospital provider. It also allows hospitals and other health systems to deliver services throughout the region to meet their acute care needs. Now, another change is being called a rapid response to expand the healthcare workforce. This type of change in the blanket waiver removes barriers for people like physicians or nurses or other clinicians to be readily hired from the local community. They then can have an expanded role to do things like testing or prescribing, even if that's not something they normally would be allowed to do. It also allows those licensed in other states to cross some state borders and provide some of these services without having to worry about any regulatory punishment. Now, the next provision of changes in this blanket order is being called patients over paperwork. It essentially waives or extends the time of which some of the paperwork burdens for frontline workers in the hospital environment can be submitted. So it's either going to allow more time to get some paperwork in or just remove the requirement altogether. And they do provide a listing of what some of those reports and documentations look like. It also allows some healthcare providers to enroll in Medicare temporarily to provide care during the duration of the emergency. Another change is to promote telehealth in Medicare, dramatically expanding the number of services that can be used to furnish telehealth and be therefore billed for it by the healthcare provider. As many as 80 additional services can now be billed to Medicare as a telehealth service, where before it was required to be face-to-face. Now, CMS has issued hundreds of waivers very quickly to states, to providers, to physicians, and to associations of physicians. With these blanket waivers, like we said, these providers don't need to request these changes individually. And they do impact some of the changes some states might have wanted to make themselves. Some states, should they still apply for their own Section 1135 waivers? For some states, the answer is yes. Like we said, 40 states already have 1135 state waivers approved. The remaining 10 states might still want to request changes because they would go beyond the scope of the changes provided in this blanket waiver. Now, we do share two resources in the description below. The first is the press release coming out of the Center for Medicare and Medicaid Services. The second is an interim final rule that governs emergency preparedness relevant to the blanket waivers we're talking about today.